Hey guys, welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing how to describe the tissue around a wound, so the peri-wound tissue. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. Okay, so we'll go over all the different things you could see on the peri-wound tissue. So we'll go over how we actually describe it. So the first one is just intact, unbroken skin. So this would be an example here, okay? It's unbroken skin. It looks like normal skin. There is a little bit of reddening to it, but for all the purpose of this, it's unbroken skin. So it is intact, even though it has a little bit of redness, or it's pink, it is intact tissue. Okay, now next we have erythema. So this is reddened tissue. Okay, so the actual reddened tissue that looks like this. Okay, that's erythema right here. Okay, then next we have indurated. Now this is the abnormal firmness of tissue with, you can actually like feel the borders, okay? So see this right here where you can like almost like, you could just looking at it, you can almost feel the borders. That is indurated right here. Okay, now we have macerated. Now this is your white, wet, waterlogged. It's from unmanaged exudate. Okay, so it's too wet. We would need something thicker, more absorbent pad on this, and you want to get to this quite quickly because it can, if it's being waterlogged, the tissue is just going to start wiping away. The wound will get bigger. Okay, and that is your macerated right here. Now your excoriated. This is superficial loss of tissue. Okay, this would be this one. So see the superficial loss of tissue. It's excoriated. So it's just like that top layer of tissue is off of that. A lot of times we see this with if fluid is sitting on the skin. So any type of fluid, whether it be urine, fecal matter, even exudate can cause this sometimes, okay? And then we have calloused. So this is thickening of the skin. See this a lot on diabetic feet, diabetic foot ulcers. You will have this callus around the wound. Now, if there is a callus around the wound, it does need to be removed. So whether you can do that yourself, it normally has to be a trained professional. So it just depends on your training. That needs to be removed. Now, don't try removing that at home because I have had people do that at home and it causes this wound to get so much larger because it's really important that you're still leaving a layer of tissue there and not going to open skin, especially with diabetic foot ulcers. Super hard to heal. You don't want it getting any bigger or accidentally cutting too deep. Okay, then we have fragile. So this is tissue at risk of breaking down. So a lot of times we have this with the elderly. Their skin gets so thin, it's very fragile. So that's how you would explain that. And then other, this is just anything that you can't place in the above categories. So weeping, dry, rash, blisters, tape tears, edema, bruising. You can explain that all also, but here's all the other words that you really should know when you're explaining the peri-wound tissue, okay? So I hope you found this video helpful for your daily practice, and I will catch you guys in my next video. See ya!